Hi, I'm Jeff Haynes, a student in the Masters of Science in Nursing program at ECPI University. Welcome to today's presentation, Meeting the Patient Needs, an Increased Awareness of Communication with the Deaf Patient. This presentation is for you on the Patient Education Committee to have a better understanding of the circumstances and communication needs of the deaf patient. Here you can see the three learning outcomes for today. At the end of this presentation, you should be able to compare and contrast three factors that will either hinder or improve communication with a deaf patient. You should be able to construct or describe a best practice model of how to situate people in a conversational setting that's both respectful and allows minimal distractions for everyone. And lastly, you should be able to identify two local resources that can provide American Sign Language interpreters when you're needed. Before we start, I want to define the terms we'll be using throughout this presentation. Hard of hearing is a broad term that refers to anyone who has lost any hearing. They may have to use a hearing aid and may rely on sign language as their hearing diminishes. Hearing impaired is a term more commonly used by hearing people more than the deaf community. It's used to describe those who don't hear as well, and it's more commonly perceived by the deaf community as a negative, a disability, or as a term that conveys deficiency and lacking. Deaf, described as little d deaf, is an adjective that describes people who have little or no functioning hearing. Little d deaf is descriptive of the ability to hear. Deaf, described as big D deaf, is a noun that identifies a particular group of people who identify themselves not as having a loss of hearing, but as having a deaf gain. These are the people who live and embrace a non-hearing life and do not feel they are impaired or missing anything that we, the hearing, do have. They've learned how to use sign language, and as their primary and sometimes only language of communication, they expect to use that as a means of communication in a medical or healthcare setting. American Sign Language is a visual gestural language for the deaf that uses hand gesturing, posturing, and facial expressions to express a thought or a word, and it's not an exact English match. To get an idea of why you as a nurse need to know about the deaf patient, you need to understand the size of this group. They truly are a silent minority among us. 10% of the total population has some form of hearing impairment. That equates to approximately 28 million Americans. And of that number, 738,000 are profoundly deaf. Of that total number of Americans with profound deafness, only 200,000 to 500,000 can use American Sign Language. English is learned as a second language, and it needs to be understood that these people as a group should be looked at in the same way we look at any other person who learns English as a second language. Would you ask anyone who doesn't know English as a first language to communicate in the written form of their second language because we cannot understand their primary language? Or would we rather call for an interpreter to make sure we're having an appropriate conversation? And please be aware that it is a common misconception that all deaf people can read lips. Even under the best of conditions, an expert lip reader can only understand 30 to 45% of the English conversation. One of the things that makes it difficult to understand deafness is that there is no single level of deafness. It's a broad spectrum of deafness. Mild deafness means that a person has some difficulties keeping up with conversations, especially in noisy surroundings. Moderate deafness means that the person has difficulties keeping up with normal conversations. Severe deafness means that the person probably uses powerful hearing aids and more than likely relies heavily on lip reading even when using hearing aids. And this particular group of people may begin to use sign language. Profoundly deaf people are very hard of hearing and rely heavily on reading lips and sign language to communicate. The other two types of deafness are prelingual deafness, describes those who were born deaf or lost their hearing before they began to speak. Because of this, they don't rely on the spoken word. Sign language is their primary means of communication, and if English was ever learned, it was only as a second language. Postlingual deafness describes those who lost their hearing after they heard or used spoken language. Usually in a medical setting, they consider this 6 years of age. And this group of people may have some verbal ability to communicate simply because they have heard speech. When asked, people with altered hearing place themselves into one of three broad communities. Hard of hearing uses hearing aids and can respond to clear speech. Deaf persons, spoken or written English, and they consider their hearing in terms of hearing loss. Deaf prefer using American Sign Language and may or may not even use written English. They commonly refer to their hearing loss in a positive as a deaf gain. Common factors that impede communication with a deaf patient are often unintentional. Just because a person is slow to respond does not mean that the person is dumb. Another thing is that it is critical that you get the person's attention and look at a deaf person so they know you're speaking to them. To reduce the stress and anxiety for the deaf patient, it's necessary to identify yourself and what you're needing to do. Because a deaf person cannot hear the conversation, you also need to be especially alert to identify when you're changing the topic of conversation so they do not become confused. When speaking with a person who has hearing issues, it doesn't matter if they can read lips or not. The movements of the lips is a huge indicator of the conversation, and it's the biggest indicator of the starting and stopping points of the speech. Holding a clipboard or hand over your mouth and face removes these indicators for the deaf patient. The glare of a bright light behind you puts your face in shadows and also decreases visibility. Thinking that speaking very slowly or with exaggerated lip movements only makes lip reading useless, as nothing is normal. And deaf people feel that all things need to be shared. If not, they feel they're excluded intentionally. If a sudden voice in the background seems irrelevant to you, but it does distract you, you need to tell the deaf person what it was so they're not offended and think that you're keeping secrets from them. Whenever you have an interpreter, you also need to make sure that you're focusing on the patient. That is the patient, not the interpreter. So don't focus your attention visually and attention-wise on the interpreter. There are simple things you can do to get the attention of a deaf person that are commonplace and have meaning for the deaf person. These are considered acceptable, and if the person is out of the arm's length, place yourself in the person's field of vision and make a motion to get their attention. You can also turn the lights off and on in the room so they know to look at you. If the person is within your reach and you want to get their attention, you can tap the surface of something near the patient to make vibrations. Tap the table of the arm of the chair, for example. You can also gently place your hand on their shoulder, even if coming up from behind. This is acceptable. There are other factors that positively affect communication. These will respect the deaf patient and show you have an awareness. Gently tap the person to get their attention before you start speaking. Face the person and keep your face uncovered. Speak in a normal tone and at a normal rate. These make lip reading easier and show respect. Remember that the deaf person cannot grasp that you've changed their train of thought as quickly as you can change your train of conversation. The deaf person needs to be consciously made aware that the conversation has changed. Best practice for communication with a deaf patient is don't use family and friends as an interpreter. This may be a violation of HIPAA and the deaf patient feel uncomfortable, and also the person may be screening the conversation because they don't want to upset the deaf patient with the information you're giving them. And remember that not all words and concepts can be translated. American Sign Language is not a word-for-word translation. It has its own grammar, structure, and syntax, which gives a different perception of written English. For example, if we take the text, "You may need emergency surgery," a deaf person using sign language thought processes may understand you to mean, You in May will need emergency surgery. This is an example of a layout of a room. It works in any environment. Remember to always keep the light source at the patient's back so that it shines a light on your face. Make sure to keep the interpreter at your side or slightly behind you so that you're not focusing on the translator or the interpreter. You need to focus on the patient. And lastly, these are two common resources for the Greensboro community to locate American Sign Language interpreting services. One is the Communication Service for the Deaf and Hard of Hearing, and I've got their phone number and their web address, and also the North Carolina Division of Services for the Deaf and the Hard of Hearing. And remember that they do have people on call. You can call and tell them what you're needing and how soon. But remember also, lastly, that the deaf person does have the right to refuse an interpreter that comes if they feel uncomfortable. If you have any questions, I hope that you'll let me know. And for reference, here are the references we use for today's information. I'm going to give you a copy of the PowerPoint as well to where you can keep it for your reference, and you can also look at these articles to find out more information. And thanks for your time today.